Narissa Bailey, welcome to Perfect Health on Elastic FM with Elaine Godley. Lovely to have you on the show this afternoon.
Thank you. Lovely to be with you, Elaine.
Marvellous. So, how do you describe yourself? What role do you do at your clinic?
So I'm a colonic hydrotherapist, performing mainly colonics, but I also do enemas for clients. And I've been doing this for just about 3.5 years now.
Okay, so what's the benefit of having a colonic? It sounds pretty disgusting for some people. So to the cynics in the audience, what are the benefits of having a colonic?
This therapy is where it's black and white. So some people think, absolutely not, I wouldn't dream of doing that. And the other people think, what a fantastic idea, let's give it a go. There doesn't seem to be a grey area. I think it's becoming more and more popular with men as well as women. For me, I feel the benefits are the more hydrated you are, the easier it is to eliminate waste, the less toxic you are in your gut, and the easier it is for your body to then absorb the essential vitamins, minerals, enzymes from your food.
So explain to the listeners what actually happens when they come to your clinic.
Okay, so I do a treatment with a machine made by a company called Dotolo. It's a toxygen machine, and you would have a speculum very gently inserted into your back passage. It's a fresh speculum for every client, nothing's reused. And I would introduce body temperature, sterilised and filtered water for 5 minutes while you're lying on your side. This is where the procedure starts, while you're lying on your side. The speculum has an inlet, a very small inlet tube, and its outlet. So it's one piece of one instrument, and it's inlet and outlet. After the first 5 minutes, I would turn the water off, and I would ask you to roll nice and gently onto your back, which might sound pretty horrendous, but it's actually quite easy. I'm with you at all times, supporting the speculum, and once you're on your back, just make yourself nice and comfortable. I then resume the treatment for about 35 minutes. During the course of the treatment on your back, I will explain a little bit about the digestive system to you, and the water, again, is constantly flowing in and out of the speculum. I do some massage of the abdominal area, so up the right side of the body, which is the ascending colon, across the middle underneath your rib cage, which is your transverse colon, also known as your emotional bowel, and then down the left hand side, your descending colon. I do some manual massage, and I also have quite a gentle electric little massager, which will just help you to relax. The more relaxed you are, the better the results of the treatment. During the course of the treatment on your back, I do what's known as a series of fills, which might sound pretty horrendous, but it's actually very beneficial. So at this point, the water would only be going into your body. So you might notice a little bit of pressure change. You might feel like you need to have a bowel movement. There might be a little bit of discomfort. I control the first 4 with new clients just for 5 seconds, so they get used to that. And any subsequent fills, the client would control it. It's important to understand that with a colonic, anything can happen because we're all different. We're all individual. So what happens with one client won't happen with another, and what happens first time, it's unlikely will happen the second time.
You mentioned the emotional bowel. Tell us a bit more about that. Why is it called the emotional bowel?
So when people get very stressed, they secrete a lot of lactic acid, and it all sits in the transverse colon and can make, the fight or fly response. Right. You become tense all the time. It's the fight response all the time, and any emotional dramas or traumas you have tend to store themselves in the emotional bowel, also known as the transverse colon.
So does matter actually get stuck in there?
Yes, it can do, and depending on what you read and what you read on the internet, what you read in books, there's various schools of thought. So it's been suggested that waste is only in there for about 4 days. However, I have clients that come to me that don't go to the toilet for 16, 17 days. So clearly they've got more than 4 days worth of waste in them. And a healthy bowel will eliminate waste around about 2 to 3 times a day, but obviously we're not all the same. So if some people go 2 or 3 times a day, that's fine, but other people go once, that's also fine. But when you're going 3 or 4 days, that's not the norm. It's suggested if you don't go daily, you can be constipated, but people have different issues governing elimination of waste. So nothing's right, nothing's wrong.
Right, as you say, we're all individual, aren't we?
Absolutely.
So for people who you would describe as normal, going 2 or 3 times a day, why would they need to go and have a colonic as well if they already appear to be healthy in that department?
Because I believe we can have waste that sits inside us for longer periods. So I've read a couple of very interesting articles suggesting that waste can stay inside us for up to 10 years, 8 to 10 years. So this waste becomes quite toxic, and toxic waste is quite acidic, and about 80% of your immune system's in your gut. So if it's very acidic, this can cause disease. So it's important to cleanse your digestive system, cleanse your colon, to reduce the risk of getting disease, I believe.
And you help people with cancer as well, I understand. What's the benefit particularly with cancer?
I have seen a number of people in my clinic with cancer. They believe that cleansing the colon is a crucial part of their protocol, and I would say I think all of them tend to have coffee enemas following the colonic as well, because that cleanses the liver, and the liver is the detox center of our body. So the more cleansed the digestive system is, I believe the more likely you are to have an alkaline environment, lowering the risk of cancer or it spreading.
Right, okay. So that's interesting. Thank you, Narissa. How did you get into becoming a colon hydrotherapist in the first place?
So I was quite aware of a lady who lived quite close to me that did it, and way back in sort of 2000, when I became aware that this lady had colonics and subsequently trained to be a colonic hydrotherapist, I was horrified at the thought of anybody having a treatment like that. I just thought it just cannot be normal. However, having suffered from constipation for as long as I can remember, 2 or 3 times a week, I decided I would give it a go, and it's completely changed my life. I wish I'd done it 20 years ago instead of thinking about it for all that time. And I just feel amazing. My life's completely different now, and I've become aware of so many things as well as what I eat, which is really important.
How young can people start having colonics?
18. I will see them from 18, from the age of 18.
Do you have any sort of nice, happy stories, apart from your own, of course, of clients that come to you?
I see lots of people who haven't been able to go to the toilet for a long time. They go maybe once. I've got one client I'm currently seeing at the moment who is going once every 2 to 3 weeks. But she's going a little bit more regularly since coming to see me. So I believe that the treatment hydrates the bowel. The first place your body draws water from when it's thirsty is your bowel. So if we can rehydrate the bowel, keep the stool soft, that's going to improve your chances of having more frequent bowel movements.
What about the embarrassment? It sounds very embarrassing.
Well, To be honest, I now completely understand how when you go to the doctors, or when those ladies have to go for treatments, i.e. smears, and you see a nurse and it's their job. And for us, we're a person at the other end. So, but I now completely understand this is my job. So as long as I can relate personally to that client, and I'm always very aware if somebody's nervous, not to pressurise them, to talk to them. And I would say at least 99% of my clients report how soothing the treatment is. And as soon as the treatment started and the speculum's inserted, they relax, and occasionally people nod off. They have like a micro sleep. However, I will wake you up because I need to know that everything's okay and you're comfortable.
Right, well, that's good. So that's reassuring to know that some people are so relaxed that they nod off. Excellent. It just sounded a bit awkward if you're in the room with them, but then if you're not in the room with them, you know, they can't do the treatment themselves, I guess, can they?
They are completely covered. I offer long black gowns. They're a bit like hairdressers' gowns, but they do have an antibacterial coating on them. So they have an opening at the back, and obviously you need to undress from the waist down, but some people take everything off. Some people just make themselves comfortable, leave the top half on. And I also offer disposable pants. So if you want to use those during the course of the treatment, I would just move them to one side, just protecting your modesty really. So if you want to use them, it's completely optional. I would say it's 50-50. So 50% of my clients use them, 50% don't. And like I say, you're covered at all times with the black gown. So as soon as I know where the speculum needs to go, that's it. You're completely covered, and it's very discreet.
Do people just have one-off treatments or a course of treatment? What do you recommend?
Well, it's difficult to recommend without seeing a client, as I'm sure you can understand. Everybody comes for different reasons. But for people that are maybe very constipated, I would possibly suggest two or three treatments quite close together, and then maybe maintenance treatments. But I can't say now I would suggest you come every month because I haven't seen you. So every client is individual, and I can recommend when I've seen that client.
Okay, so when you do the treatment, there's a lot of talk about gut health and microbiome and so on. How is that affected by having a colon?
Right, so during the course of the treatment, you get rid of good and bad bacteria. I always give them a capsule following the treatment. So a probiotic is live bacteria. You can also get something called a prebiotic, but the prebiotic is the healthy diet where the probiotic can sort of settle in and multiply, repopulate the gut with healthy bacteria. But you can get a symbiotic, which is a mixture of the two. But if you've got a good diet, then you're fine with just a probiotic capsule. I also feel that the products you can buy from reputable health food stores are better than the products you buy in the supermarket because of the sugar content. Also, I take a product called kefir. I make mine with raw milk, which is like a grain, and there's lots of information on the internet about this. Some people don't recommend raw milk, but I find it absolutely fine. And kefir is like a grain, and the grain eats the lactose in the milk. So for people that are lactose intolerant, kefir is okay. And I have had a couple of clients who have managed to heal themselves from Crohn's disease by taking kefir. So I believe the more natural the product, the better.
Absolutely, brilliant. Okay, well, thank you for explaining that in time this afternoon. How do people get hold of you, Narissa? Presumably, you do. Well, maybe you do. Do you do any consultations? Obviously, they'll have to come to you in person for the treatment, but do you do any online consultations?
So if somebody's interested in having a treatment, then I can speak to them and talk them through the process. If somebody books in for an appointment, we spend about 15-20 minutes doing the paperwork. So it's important that when clients ring up for a treatment, if they've got any health issues, we'll discuss them before booking them in. So recent abdominal surgery in the last 6 months, I wouldn't recommend seeing them. If they've got an uncontrolled condition, so they've got heart disease or uncontrolled diabetes, then if it's uncontrolled, then I wouldn't see them until they've been controlled. And if they've got a flare up of something like IBS, IBD, Crohn's, then it's not a good idea to see them either. So we can discuss anything if they give me a ring, or they can drop me an email, and I'm always happy to go through what's going to happen. And then if they want to book an appointment, we can discuss it further on the day.
Okay, so your clinic is in Nottingham, and
that's right.
What's the website, Narissa?
So the website is Serene, spelled SERENE, colonics at beg your pardon, start again, www.serenecolonics.com, and my email is serenecolonics@gmail.com.
Brilliant. Okay, so we shall put that out on the show when this interview airs.
Okay.
I normally ask for 2 songs from my guests. You've come up with one absolutely stonking one. So why have you chosen Bohemian Rhapsody by Queen?
Because it's probably the best song ever. I just absolutely love it, and it's one of those songs where I think everybody joins in, and if you're feeling a bit low and you put that on, you just can't fail to feel absolutely fantastic afterwards. I just love it. My daughter loves it, my son loves it, family love it, friends love it. I love it. It's just great.
Brilliant. So we'll be playing Bohemian Rhapsody by Queen straight away for you, Narissa Bailey. Thank you very much for spending time with us this afternoon.
No problem. And just to say, I do have a Facebook page, so if people want to look at more reviews, it's Serene Colonics on Facebook, so there's quite a few reviews on there as well.
Brilliant. Okay, and don't forget to post any time on my Facebook group, Perfect Health with Elaine Godley. I don't see you posting on there, but you're very welcome to post on there, Narissa.
All right, lovely. Okay, thank you very much.
Okay, fabulous. Well, take care. Lovely to speak with you.
Yes, and you. Take care. See you soon. Bye.